Welcome. Welcome, my dear friends. I welcome you all in my Ayurveda Academy YouTube channel. Today's video is again a part of the subject Shalya Tantra or surgery for fourth year BAMS students. This is as per the syllabus. The topic is anal incontinence or stool incontinence. That means defecation without control. No control. Defecation occurs, stool passes without control. That is called as a incontinence. Okay, presented by myself, Professor Dr. R. Deshpande. I am MD in Ayurvedic Medicine, Kaya Chikitsa, and MD in Kriya Sharir, that is Ayurvedic Physiology. My WhatsApp number for paid online consultation or paid online classes 922681060. So my dear friends, let us start the interesting lecture about Shalya Tantra, that is surgery. Yes, for fourth year BAMS, Bachelor of Ayurvedic Medicine and Surgery, CCIM syllabus. Central Council of Indian Medicine syllabus Abhyas Krama, paper 2, Shalya Tantra, surgery, part A, point number 13, diseases of rectum and anal canal. And this video is regarding anal incontinence or stool incontinence. Anal incontinence is defined as, definition is very important for the oral, for the viva, for the practical. They will ask you, what is anal incontinence? So, anal continence is defined as loss of control of defecation act. No control, loss of control. Anorectal ring is the important structure to control the defecation act. Anorectal ring makes the junction between rectum and anal canal. Anorectal ring. It is formed by puborectalis, highest part of the internal sphincter, longitudinal muscles, and external part of sphincter. Anal incontinence causes traumatic to the rectum and anal canal, trauma to the rectum and anal canal, surgical procedure of rectum and anal canal, neurological causes, and last but not least, malignancy, cancer is also cause of anal incontinence. Fifth cause, congenital anomalies, old age. This is very important cause for anal incontinence, prolapse of the rectum, etc., etc. Malnutrition, rectal prolapse or prolonged prolapse piles is also cause of anal incontinence. Diarrhea is also cause, irritable bowel syndrome, IBS, and psychological, manasik, psychological problems, stress, depression is also cause of anal incontinence. Treatment, temporary incontinence. What you can do? Ashvasana Chikitsa in Ayurveda. Reassurance, counseling, don't worry, be happy. Tell the patient, don't get afraid, don't get panic. It will be get cured. It will be get cured. Then perineal exercises to improve the tone of internal and external sphincters. Sushira Snayu in Ayurveda. Suturing of the torn sphincter. This is also the management. Then permanent incontinence, intersphincteric repair. See the cursor. Intersphincteric repair of puborectalis and plication of external sphincter. Plication. Okay. So this is surgical intervention. Tatra dharmendriyanam adhikaraha. So this is very small topic regarding the incontinence. Okay, this is fourth year's BMS point topic from the syllabus, CCM syllabus, paper 2, part A, Shalya Tantra surgery, point number 13, diseases of rectum and anal canal. And today, in very 5-7 minutes video, we have seen about anal incontinence or stool incontinence. I request all of you to share this video, like this video, and don't subscribe. Don't forget, don't forget to subscribe my YouTube channel. I wish all the best. and please take care. Sarve Pisukina Santu, Sarve Santu Niramaya. All